Otumfo Nyankopɔn inhyira na asomdie enkan ɔde hwɛ saa me wafidie gusuda ITV Apomuden Ye Ahonya dwumadie so ni osomfo Dr. Ahmed Kwaku sumidi dwumadie ho hyame ene kwasi yi wo hwɛ wo time 7:30 abodada enkopem sɛ 8:30 bɛbɔ don hwɛ baako a ɛwɔ yanim yi di yɛde bisua de na ene yɛde sua no ɛyɛ sonko efi sɛ Nyankopɔn bɔ ɛba asase so sɛ yɛmra ne yɛmɛsom no na ehia sɛ nipa nso no etimi nya akonya sɛ wobetimi awo na wagya achirima na emom no ene topic a yɛ si hɔ ɛyɛ infertility ha nipa bebre pa ɛyɛ sɛ awo ɛbɛyɛ den ama oba ana berima ana sɛ couple no ɛno ho nkomodie den na de saa ɛhaw no ɛba anamonto bɛ na sɛ wo ɛhaw bi saa wobetimi atu a ɛbɛboa ɛna doctor ni yɛnya no afidie so no ɛyɛ da wakwadre na wo nimdie sonko ɛfa topic a yɛyɛ so bɛka ho asɛm tiko so ma wafidie no ɛna ITV na sene bebia no wo akonya so sɛ emra dwumadi ne kɔ so no bɛsend me WhatsApp message ana text message na maken kan de ama wo sɛ wasɛm bi sɛ bia nso ma doctor na bebusa no ɛde ama wo sene bebia no ɛna nso no nya ne ba health college for ɛwɔ ha ɔmo ɛbɛboa ɛma ɛyɛ health tidbit segment no ɔmo de abrɛ mi twa me ho simaketu bia ba me ba na ɛyɛ nya ne ba health college students at this segment no at the abroad. Kosomo fide na hambasisi ya.
Hey, doctor. Now when you it is so dear about one soy, not so many and yawa. Only carpenter twins here, doctor. We really want to declare. Jaman pound 20.
Meaning, me up a ponsius. A yes, so I'm meaning soon in I am a pussy. Open a camp for doctorability, mamma, and I'm so mammy by.
Ah, sister, as you are the Health Republic Homeopathic Center for the Rufu Gaga by a lutein vitamin A and E salt gel capsule. I'm a Mijinahi. No, no, or a Kusuku, a way Nimami who away Chiswami who. Every way I want to know. Who could you crown Name? That's Tima. Start sorry na kuku editor. There could be a some soja sister. Or friendly sciatica cream. There is sciatica cream. First, no. So for market or Tinawa, no waka. I say the car near the coffin and the Sunday, the mammy didn't share all a million na wager because of sciatica cream. Sister, the phone point then the hour at it.
Hwehwɛ Health Republic for ɛwɔ Ecobank ɛwɔ Malam Junction.
So wo pay duro dia 0557 268 8288.
Good evening. Welcome to this Health Tidbit segment. I am Ifada Vera Peter. With me is
Blessing Okore Nwevo.
On today's episode, we'll be looking at the topic infertility in both men and women. Infertility is a medical condition characterized by an individual inability to achieve pregnancy after 12 months or more of regular sexual intercourse. Do we have any causes of infertility in men?
Yes, we do have a lot of causes of infertility in men. Firstly, we'll look at the low sperm count, which is the low sperm production in men. Secondly, we have the blocked sperm ducts. That's the blockage in the epididymis, vas deferens, or ejaculatory duct. Thirdly, we have the hormonal imbalances. That's issues with testosterone, follicle, stimulating hormone, or luteinizing hormone. Do you have anything to add to it?
Yes, we have the genetic factor. And with the genetic factor, we have chromosomal abnormalities or genetic mutation. We also have lifestyle factors, which include smoking, excessive intake of alcohol, obesity, and certain medication. What about in women? Do we have causes of infertility in women?
Yeah, the same way we have causes of infertility in men is also the same way we have in women. And in women, we have the ovulation disorders. That's the issues with ovulating, such as polycystic ovary syndrome. Secondly, we have the blocked fallopian tubes. That's the damage to the fallopian tubes. Thirdly, we have the endometriosis. That's growth of endometrial tissue outside the uterus. Is there anything you can add to it?
Yes, we have uterine or cervical abnormalities. That is when there is an issue with the cervix or the uterus of a woman. And we also have hormonal imbalance. That is issues with estrogen, progesterone, or other hormone levels. Do we have the general cause in both men and women?
Yes, of course.
Okay.
So we've talked about the causes in men and also the causes in women. So now we are going to be talking about the general causes in both men and women. And we have the age. That's advanced age can affect fertility in both men and women. Secondly, we have the lifestyle factors, which is poor diets, lack of exercise, stress, and certain environmental toxins. Thirdly, we have the medical conditions. There are certain medical conditions like thyroid disorders or pituitary gland problems. Sister Deborah, is there any treatment option to this infertility?
Yes, we have fertility medication which can help stimulate ovulation or improve sperm quality. We also have surgical procedures such as tubal reversal or vasectomy reversal, which can address blockage or other anatomical issues. And then we have the assisted reproductive technology such as the IVF, ICSI, and then the IUI. Are there any other things you'd like to add up to it?
Making healthy lifestyle choices such as maintaining a healthy weight, quitting smoking, and reducing stress can also help to reduce fertility in men and women. And that's all for today's segment. And once again, my name is Blessing Okori Nwevo.
And I am Ifa Deborah Peter. We are from Nyaneba Health College. See you same time next week. Bye.
Hey, doctor, it is so dear about one soy, not so many and yawa, or any carpenter trees here, doctor. We want to declare. Jaman pound 20.
Meaning, me up a conscience. A yes, I am meaning the swing and I am a pussy. Open a camp for Doctor Mammy, and I'm so mammy by.
Ah, sister, as you are the Health Republic Homeopathic Center for the Rufu Biaga, or a lutein vitamin A and E soft gel capsule. I'm a Mijinahi. No, no, or a Kusukusu, a way you mammy who away Chiswami who. A do real award you. Who could you cry? Name, that's Tima, me. Start sorry, not a bit. There could be a Samsung Diaga, sister. Or friend, sciatica cream. There is sciatica cream. First, no, so I market or Tinawa, no waka. I said the car near their coffin number 2. It's Sunday, the mammy didn't cheer or any young now wager because of sciatica cream. Sister, if I won't point the diamond, that's it.
Hwehwɛ Health Republic for ɛwɔ Ecobank ɛwɔ Malam Junction.
Sɛ wopɛ eduro ne dodoɔ deɛ a 0557 268 8288.
Sɛ Apomuden Ye Ahonya ɛwɔ nipa biara abrabɔ. Enti sɛ deɛ ɛbɛyɛ a wɔn toto Apomuden asenete na mekanfo Health Republic Homeopathic Clinic ɛde ama wo. Wote yaw ɛwɔ w'ani so a ɛyɛ lutein, vitamin A and E ɛna yɛ use ɛwɔ Health Republic Homeopathic Clinic.
Hey, Semenshia. Ah, sister, me chawan. What they do for frukra asanaba. Sir, she fertility for women. Only for the other now, any problem.
Hey, doctor.
Shit, no, if you don't want to know him, what? Fertility for men,
fitted for men. Anyway, Benina into in Kwabwa. I'm a king. I want on one else. In Kwabwa. I will lose my account.
Wait to me after Health Republic Homeopathic Clinic. That was 0557 268828. So if we kaswa quantum pono so and an airbag, you will on sa ebe kumuso, yani Eco Bank, any MTN, and a water diachrome, our Malam Junction.
The chairman of GBB say we feed Gusuda IT because some of feed in the and confirm say 30 bebono ya de Apomuden ho enkyerɛkyerɛ ne de bra o dwumadi so some for Dr. America Cool so ne topic ye si ho no infertility awo ho asɛm ana eba bɛka pa na ɛdeɛn ana etimi si awo hwan Dr. Andrew Sofosu ɛwɔ hanom a yɛsan enya no wafidie so mugidi sɛ bet na wɔhwɛ bɛ miɛnsa mu ni ana enya na ne bɛhwehwe nkɔmmɔ Stronko and so yenya no dog when more kwaba stronko
me da se me nia
be enya no afidi you say na ya na mania de ye pa because send ya na won chirichiri mu e yare mu esiko no na ene ye hwe infertility ansa na o enchia bi abechia obi a na afi ye ka infertility so a wonya abotra chirichiri mu
okay the kind of mechia me boss ba ko bi a ye friend say Godwin.
Okay.
And then a special birthday. And then so nyame na dom was starting a church.
Okay.
Ewo pram side home. Me chia pa na ye ma wa mo any ayi ko so. All right. Enti ye ba infertility ne so. Infertility my hu ni twi no unya ni twi na na.
Oh, say infertility no. Dodo na no enchirimu e de be kire no ana bebo ama entiase na ye adwuma ti ni particular word that with me dey say
okay yo enti ye ka say infertility na ye ba be pa kire say ebia oba ontumi ngo ana say obema ontumi ma oba enyinsen
okay
aha enne ye infertility
no de ba sa de a wo penitri de ende ye wodin wo ho oba de wo ho no ye obema so de wo
ene fama me nanka na use ne preko
there you dey chichimu yaza
okay all right enti say ye kan infertility a e oba ontumi attain clinical pregnancy good now but the definition ni mo no ye say obi a wa have unprotected sex over a period of 12 months sex and so regular.
Okay.
You say be a once a regular or more tie have sex be a couples. Now over this 12 period no on to me achieve pregnancy. You say be a on give birth but on to me achieve pregnancy a friend clinical pregnancy.
So you saying to me my
na you saying to me my no and no na your friend say or infertility issue.
Okay.
Now, but ansani betimi a qualify no say ye ascertain say be ma no ni issue no or ye fertile or no de otumi ehyenyin
okay.
Aha. Because if you say be ma ni ntumi ehyenyin automatically won't soon to me insane.
Okay.
All right. Any a banner a mema na femudia. A mema ne de a Meribian shed that any who said within 12 months and to say a man de of course a man and so the no and yet within 12 months in Kwana but say where the 35 years kwa what the any 6 months and by 6 month time I will have a irregular unprotected sex no na so nyin say I have a clinical pregnancy enya MIN nature say or infertility.
Okay. So look, say you use the word clinical infertility, clinical pregnancy. And what's the difference? Pregnancy be on my and clinic no what's the meaning?
According to American Society for Reproductive Health, reproductive medicine, sorry. Or more define the pregnancy say on say ectopic pregnancy pregnancies be the HCG no and detect HCG ye won san no moja near the aso Dixon so near the detect say when you say and when you say but clinical pregnancy pregnancy ye the ultrasound scan detect now you use the ultrasound scan sorry ye who the sac the sac no contain embryo. On say binum wo ho a betumi a sac no but embryo enim aye friend no blighted ovum. Enti na ye qualify ye de na kan say clinical pregnancy.
Okay. All right. Enti kosoma me enti no ye hwe infertility na wo che say yo oba ono no awo hwan ne dene. Ana yo bema. Ti say na nya na ba health college for a boy my tidbit no. Yan di kan hwe eye emma ne de no. Oba no oka say obu oko 30 years and above.
Yes, 35.
No de no 35.
Yes.
Ono de no within 6
months. Yeah.
Okay. Enti normal be pa na timi eba oba so a emma otimi nya sa problem etisa.
Okay, na niema bebre but number 1 ese etumi ascertain say be ma na oni ni din hyemu no fertile.
Okay.
Now aside that no your hormones be e woni padua ni mu a omo contribute significantly to pregnancy, formation of pregnancy. Number 1 hormone be a friend estrogen and progesterone. If the progesterone no cry there usually within menstruation you better and can be because on a break it down the endometrial line and said what we call blood and bit to me about abonting. And it says hormone no ewo form to me conceive sa hormone no form to me conceive your follicle stimulating hormone and so FSH say sa hormone so eni ho a to me and to kosua no
okay
empuna like what being insane nti eno so a problem your infection infection your infection mean usually your normal urethral infection na what Johnson tramu no and no by wo de develop ana say enyi ana didiko awodi animu and your friend no PID pelvic inflammatory disease enti eno no sa no say infection no eba especially awodi animu ana say fallopian tubes ni mu a no like the broth na ye ebe blocky tube no enti say you release egg na say emra uterus ni ma nam kwan ne so ba na ebe block into me emma metum enti esa na usually be lead to ectopic pregnancy ho no
enti eno na yetimi che so bu no ma wo say okọ hospital no doctors ma try ne say any tube ma block and any tube ma ifi.
Yes, but not necessarily a more but I block it. Generally, no be say more block it. Inflammation, if I say pipe be a more smooth, but see now say bumpy natures be a developing tube in the inside, and the smooth flow of the egg no emma, and a bed block it.
And the air sana. Sa blockage no koso sa na oba no on tehwe
obeti ebe ne ya PID number 1 obeti pin number 2 o have sex at the adnesia no obeti say ho ya be man ne trust inside pe bo say e bo pe na ya o ya 2% o stop it be man and afin so ensio ebe gina Wumfimwechi Hase. We are friend of Porch of Douglas. It's an also your local hospital near scanner. Ebema who say oh PID.
Apart from infections, no. The other causes be the problem the basa.
Yes, yeah. Well, other causes being so hormone your hormones be and say dose at a particular point. A man so testosterone and your man can testosterone. A man testosterone, but testosterone a very low. But so your bar, not so testosterone level no was sure a be hinder pregnancy development. And number 2 prolactin. Prolactin a hormone a boa emi de produce breast milk enti breast milk no eba the indication sickness and ma adwen ne say sisi ni ya wodada abofra ni so aye feedi no enti no ense say yesan e conceive akwala foforo biem aha enti eno so ebetumi a block nipa no chance of delivering
na doc emma no obi ono no otimi nyinsen kama but eya na miscarriage take place be 3 times ono so no itimi classify ne say infertile
yen to me and classify no classification ye wo mu ahodo mienu ye wo primary infertility and ye wo secondary infertility but under secondary infertility ye wo mu two and the primary infertility ne ye ono de onyinsen bi na onwo bi secondary ne ye wa wo baako anase watumi achieve conception yet to me as a clinical said them they can treat you yeah certify say okay nyinsen no wo but when to me and keeping nyinsen to 10 and or you fertile there but just that on to me Andrew 10 that is the only difference
that's fine and you know obi sa na de yentimi
and cancer or you infertile there be
fibroid ne ovarian cyst no and also who asem to say about awo majmua
yes beautiful and he say obi ewo fibroid ansana egg no kosia ne be free fallopian tube ni mu aba bedru uterus ni eba uterus ni mu aniema mienu enesi corpus luteum anase the later be develop to placenta no eno ene be di kan abana be hooking ne ho to the uterus said be a obe stay honum no dey develop it and it's a nipa no ewo fibroid depending on the type of fibroid na nipa no ewo no say bia intramural and say subserosal depending on the be one say fetus no kwako edene ho kwako join sa area na I mean because say fibroid ne she ho e be prevent the child from coming fetus from growing enti nipa ne to me achieve the pregnancy and e binu so wo omo de ne ben fallopian tube no such that a blockade fallopian tube no e wo ho ye wo polycystic ovarian said the polycystic ovarian syndrome and ye wo primary ovarian insufficiency and the polycystic ovarian syndrome ne say ye wo balloon and fluid filled sac enkete a ebe fa egg ne ho enti eyesa na fertilization of the egg no very difficult enti into me manipa no and develop zygote abeba be fetus ama wotimi anyinsen and primary ovarian insufficiency ne ye bosumi bia dra oba to kusia but usually enye kusia baako now sometimes it depends on oba ko a or to kusia but enye kusia baako na oba ne to otu kusia bebre then the system no ebe choose kusia wa mature na oye healthy enough as a sperm ebe can pe obetimi a fertilize na push onu no moma the others ni nyina ebe die off na eno aba abe fertilize but in primary ovarian insufficiency no kosia no entu bebre enti be 1 2 bi na wo ho no enti because it's not enough no only option to choose from anything it's because of that insufficiency no to me a blockade
ovarian cyst the word ovarian cyst no how it me ma no
yes
ma awotin homo omoden
yes
ada causes be manim yes ade anke be come manim
there be so far so we have been referring
okay
me kaya ye be san ya ba
all right afi yenko emema no so oba no problem bia ni ne ho so bema on na te de bema no problems ben how ben the timi wo mema ni mo a ema bema itimi ka se bema we ntimi ngo
okay so how ahodo ba komienu bi a ye be bobo so ye be start wo hormonal no ba emema no problem no enye complex say ema ne de no emema ne de usually one sided it has to do with the sperm that's all enti ye wo testosterone and they say Leydig cells na what testis ni mo ebe produce testosterone. Testosterone no ebe stimulate cells be efe omo Sertoli cells. Nti omo and ebe start with the production of the sperm in the seminiferous tubules. And sana omo produce omo wia no omo aba epididymis nim. In the epididymis no omo ba be differentiate head and neck tail no middle piece and tail and omo be sua how I swim and sana omo aba out. Enti se hormone no testosterone level no ewo form a yentumi produce sperm no ema na enye yi
eno na problem timi de wo bi ye be wo no na ne de no ntini wo nyini nyina no wonya quality sperm da.
Yes, etumi genetic. Etumi genetic and obi wo na testis na gasa so ewo problems bi a ye be ka ho asem sisi a. Yewo enti se yentumi am produce sperm ne dia ontumi nyinsen. Ena yewo said ye in college for no ebe chire mu no yewo blockade in the tubules. Enti sa epididymis no free mu a na oba vast difference nim no aba ejaculatory duct nim tokro no mo ne na mu sa enti se emu bi a block ya there is no way sperm ni betumi afam aba. And finally no obi owo prostate disorder. The prostate disorder na during sex no and answer na ejaculation ebeba no. Say prostate no eto urethral nim no we be the channel for the semen no. Na semen no aba abonten. But sometimes the prostate will close baby a sperm ni mum air fan even during ejaculation no we be urethra ho de it is a semen ebe block na assign afa jonso twa ni mu ho de akọ back to urinary bladder no eno ne friend retrograde ejaculation. It is a problem we ewo bema bi wo bi a eno nso ebetumi
no be shia
semen no emma bonten a sign echo back and also a problem yewo varicocele yarea the testis no scrotum na ewo ho no veins na e supply e say etwimoja ko na adwen no e sign stimulate me edi moja foforo ba no ye akese enti emma entumi em function said yes say function yewo yare bia ye frɛ no cryptorchidism ebia abofra no yewo be man yewo na time na wo sa no nanka usually yewo kwan ewo wahan mu a esese testis ni fam ebeto showani musa but ono no de ye wo no aba no eka ho edi echeye ansana eba enti nipa no ebia through surgical means no ena ye eba ne beto mu usually ebia some process no ebetumi ahenda no kakra
enti no sa we ni mu nyina no na solutions ewo ho I be bo nipa and you be on more I condemn there's nothing that can be done.
Well in medicine no yen said that ni ade se we need condemn there enti study a problem no etie no as it has been diagnosed no na ya hwe ho asemaka enti finally ewo sperm ne so no obi wo wa produce bi but it's oligospermia it's obi nso wo wa ontimi produce sperm ni bi kra enti nsuo na eba abonten no just a liquid na a free prostate ne seminal vesicles ne hono pena carpus gland na eba abonten eno ne ye azoospermia ebinu mo nso wo ho motility problem ya releasing na ese osweme to aso no ontumi sweme ento aso ena yewo ebi nso wo a omo shape ne omo structure no bu anani tina ye kese bu ani tin kra ye miensa ene ade anti those factors no emwa ema ye ntumi achieve pregnancy.
All right. Doc, you bet to aso baby edru no yase eje enkrato kakra free aboafo ho nemum dedi kan no entry herbal center na entry herbal and spiritual center omo dwumedi omudi no Dr. Entry a odi omo animu kan no dwumadi omo di no sonko omo no de ne se wo hawo no se eye wo se wo de acquire sabia eye aban hospitals ene allopathic hospitals we dey call other herbal clinics bi na ade we anya ayaresa say adwene mu yare nko a de a say bibi te say etwere ana say edam ana problem bi e fa utirim say ye waso say ye woni how bi e te sa no utu ho anamo e de ba eye NP Herbal and Spiritual Center waka so baby ITV premises no na ye chipe ho ana NP Herbal Center ewo sanso na say wo koku na koku no etu ya woto we ye die fifi ni bia na wo die chini a wo ye panyini sen. It doesn't matter opposition in society or the free Dr. Entry our number we so dia obitimi abo we yi pa how horror amabo so no 0244 566 023 0244 566 023 0244 566 023 Sansona Health Republic Homeopathic Center almost so ya senepa ye dwumadi so almost advert na ya na ye bono dog na yeguso a yetwe nkomo no the question person mebusa ba ko ne say on say ye wo se obi wo ho no mo a ana couples bi wo no ma oba no ni hawo be ma no susu ni hawo enso mienu aba be hia no na akoba se hawo ho enne se aware ni yagu ana relationship no munya tesesi a oba no call ya bo so akonyinsen be ma no so call ya no so akonyinsen oba hofro eno so eye de yan
yo you know sometimes in coming up with pregnancy and factors baby go through even psychological factors stress any dey account ni nyina etumi contribute the timing of the sex and so a contribute
say or some have sex na no pa na say we
oh there be
nyene say
your friend of them menstrual cycle no enti ye wo ebia ye wo in 4 phases ye wo the phase na menstrual cycle menstrual period na nkasa and ye wo follicle stimulating phase e wo ho na fe ne ye to kosua no and ye wo luteal phase no na e honom na you can say Kusiana I ready ye train so your ovulation phase no a honum na ya ready it was oba na bi ensio kakra be gu no na say o felis ne honam be ye kakra ene ade e na luteal phase ne ya ready ye train say egg pregnancy ne ebeba na ya to aso afri honum it will be one onim safe period e na onim unsafe period ono de ene say and me feel say me have sex no yen have sex there be enti say unhia e bad ya you can have sex anytime but unhia ba some of this period no where you should position your sex nti mo be share mo menstrual cycle no mo hu where best e be fit ya mo have sex e be productive
nti baba say such a couple no omo nim the actual time no problem but the whole of the year 12 calendar months na akoba say ya de a omo ntimi follow so simple way nintino this simple thing nintino na awo no ntimi emba
e very
nice screen so ade wo kana na megidi say that so
I eno ana no eno ana that screen so enti say ohwa day 1 to day 7 usually menses in 7 days but a cycle is giving us an idea what the thing really is and the proliferatory phase no e honom na afi kosuato no ye starting but proliferative phase no overlap with the menstruation or having menstruation no na no so start along the line ovulation phase okay now the egg is matured kosiana yaton I am matured and then we enter the phase you release ovum no say afi or you ready for fertilization enti say you release no say blockade bia eni ho a having the sex you should be able to impregnate your wife
na ebitima ba say aside this no bibi foforo ho a ama ominu ete no anya dia possible say nyinsem ba
yes bibi sa ewo ho sometimes blood like your blood types no
okay
ebi wo ho a obi ni obi de enhia but bia obekọ baby foforo no bo say na ayeyi eno nso ewo ho
and your blood group na some na okay na
blood yeah
okay
your types or resource any other factors are ekeka ho enti bi wo ho a na hia na enhia ana say ebia oba bi wo ho a owo retrograde uterus enti how obia uterus elaye say no ono de ne entisa
okay
enti ebia wo have sex na wo say semen ne be cool but into me emfu nko uterus ni enti bo say ewo ho na assign aba na chi enti those ones no so prevent pregnancy
okay enti bitima ba say bia oba bi won ma be ma no net no enni saa nimdie we onim sene wo say ka say na wono na wode no quite different the position of that wode ni different no but okobe fufuro obetimi anyinse sana opachire
o da bi enye se bia se de na wode ne tie ne ntina e bi okobe fufuro obetimi anyinse ba me kire se de awode ne ya position no eno nso ebetumi determine se obetumi a conceive na won conceive
ntisa complain obetimi aka se me ne me ho kani hia bia na after sex no when we say yes sperm ni nyina na semen ni nyina say ababa eno etisa
yes etimi banisa however Michelle however no semen de edoso ana sizable enti enye ni nyina na ebeko oba ne so ntumi nka say ni nyina na eba abonten because unni inside
eyo mo kan
enye ni nyina ono
enye ni
nyina na eba abonten
enti enja kan sa
me nka say ni nyina eya eba abonten enti de akọ ena de aba abonten that's how eno no etie enti de akọ no usually no sometimes ejina how the semen is short during the ejaculation obu ne shooting no projectile no ano nye den enti ekwa mo se gu ano he ya na assign the chi oba no so uterus shape no enso betimi determine eno so
so kise ye hu infertility no eni so no ye hwe se obi etu anamo abayare sabia ye wo hwehwemu bi wo hono mo a mo beye a beboa ama motimi hu den na ema se nipa yi se yo ba manenya sa problem no be man so investigations ben hwehwemu ben anaya na hospital moye
okay enti usually no mejina afidie so na me dey assemble ko atwem say in our culture no say obi antumi anyinsen usually ye fa ne say eyoba no the dikan no I say eyoba ne ntumi enti bo say man mom na etan eba hospital say bia me ntumi ngo na say ni ena aside that nso no obema ne beka say oh me wo JHS kra no me nyinsen obi enti no chese me de me okay wo oba no de wonya nwu bi enti no wo na problem ni feel there be entisa say de me dikan kire mu primary infertility ne secondary infertility ne ubetumi aba say wa wo ba akopen de but eniema system na sesa ama sisi wuntumi ngu biem enti wunsu hia mboa enti se nipa no eba hospital aye beje ni moja na ya ye hormonal test bi ama ya hwe se okay ni hormones ni nyina eyo on point ana be ma no so yetumi hormonal checks e ma no ye wi a na ya ye semen analysis ama be ma no say how many sperm cells and what we semen anymore. What's the quantity of semen? What is their motility like? And their morphology or more structure and so na yashe the amount oban so ye beye ultrasound scan the amount enti ye be hwe said the nikosua ne tie said the fallopian tube ne tie said the uterus na nkasa so etie na yetumi na of course ye beye we say a few questions you determine the last menstrual period near the na ye hu
so obi tube mu a block here and investigation be na
Still now, we na able to me picking it out.
Okay.
The ultrasound scan can pick it out.
Okay.
Say, oh, nipani tube more block. Usually, no, either the PID na say ABR adhesion. But adhesion, no, a bit to me an infection, a bit to me cause adhesion. And now say there was a surgical procedure be a wire before. Maybe a teacher near maybe up and palm near maybe by a year, no, I can't so. And I block it. And yes, can I be the size and the shape of the tube, no, not your the necessary step.
We pursue who say no cray. We pursue who say no crepa say frequent abortions. It me. Ebi a unyang worry, no. Emra na sebi or trempana no. Abortions be me and send me no be or no. Ebi to me, ama infertility.
Me pacho ane, but mon fanchem because bobo causes in the escape me. But abortion we ba kumpa likely say own to me and will cry
legal abortion and I say illegal one.
Well, me training me no, of course on say you were FDA so a bit to me but say we legal abortion, the work hospital, I'm a doctor na ya amount. It doesn't really change much.
Okay.
Just that because on a professional, no onim the oye. And you know, the likelihood say ubenya issue out of that abortion low.
Okay.
But it exists. Ebi won hoko ebi or MV.
Okay.
Manual vacuum aspiration.
Okay.
Ebi a doctor ne say wa bre enti nurse bi o no so chale fa shemu ewure mu sa na twetwe the aka ne bra bontin ebetumi pra uterus no. Enti like but just that no possibility ne very low.
Okay. Okay.
But nipa owo fie bia onu maduro bi anaso wate so obi ebo aduro bi hu dawro se wafa yafunu amen nom that means ni trimu no abortion do me no mo ebe say me pregnancy na no don't do that because yes na usually where baby fetus no a placenta no aba no ho escar after the abortion and after delivery and the baby and first child no etia no on some another child into me may share the same place a whole escar unless you move the next pregnancy be move it to another place
now go back
there be escar
like me
ayekotwa enti no ehon nye viable for another implant so kola foforo betare ho same place the likelihood of miscarriage is very high enti wanu aduro na bi aduro na no ye den no ubetumi achieve o purpose no but ebetumi harm the other areas of the inner lining of the uterus. And don't take some medications what they say about.
No questions. Treatment options. What of those that did multiple abortion or my multiple abortion? But has given birth to one, but after then she can no longer conceive. Question no. Say
good. Enti no de yen to me nka say abortion no ye ni nti and am want to me ngubiem.
Okay.
But abortion ni be to me akose.
Okay.
But enti is saying why ready so person conceive biom no omenye hwehwemu ni ehu what is really causing you see no de na ba be secondary infertility ti yen hwe cause no na yemfa treatment emra. Yeah.
We supposed to say family planning, implant. A bit to me, also infertility.
Yes, a very yes.
I can't bear so. Implant, I say, then I go on my wood or here, no matter crow.
Okay, and family planning was the essence. The family planning, amount they say. Buana hormones na ye bobo so estrogen progesterone na buama watumi conceive no suppress no said ye be ya ontumi enyinsen enti enye de prevent awo ne nko but there are others be we having sex we also mame no tablet way na pill no those things no aside some of them being spermicidal no there are some that also suppresses the hormone.
Okay.
And the implant ne ye pie or skin nase na ye de show I say topa ye white bisa near the wura or skin nase ne account to me say 5 years and 7 years, but depending on because obedi kan ye counseling say hospital now call ya obedi kan ye counseling amount no what choose see years and months I hope say we no in that month ni nyina no your hormones have been suppressed. And the time ne so a obekwa ko ye fi ho. But unfortunately ebinum wo ho a omo de omo hormones ne entumi insan ma back alive. Omo ntumi insan producing biom a suppressing for good. And the family planning and so etumi e cause sa. Enti se obi wo ho no mpese obenyi nsen ebia wawo ba ko or twen se ebia 2 years time and 3 years time and mesan awu bie mu a yen check yen use some methodologies bi and ebia the short period ones ni bi and as husband ente ase nkwala na ya adoso enti this day ebetumi na yenye no boko wo fie. Now the moment that you are introducing chemicals into your body, your body's usual way of doing things it's not the same anymore. Enti that is
no question is the go so bad
emra ye wa ha ye wo brema omo.
Okay, but yen share a year treatment options no. Health Republic Homeopathic Center our sponsor edwumedie ade a ye bo adwo ho dawuro a fertility for women and infertility for men. Ye beka a year solution to infertility no. Be say oboaye na de film saa enru atete saa no ade e betimi aboa asolve infertility problem.
Pepa cho ane on say sometimes ade ba ko a ense say ye refi ni say enema mienu titu. Number 1 enhancement.
Okay.
Number 2 fortification.
Okay.
Say ade no wo ho de but ye boa no ye push no amana tumi aye na adwuma ni yie more anti we share screen is to say we need a fertility for men.
Fertility for men.
Anti men de no ebe hokru tubes nim. Number 1 a few of herbal plants.
Okay.
And ya can boom ediaye. Okay. Number 1 ne ebetumi aboa clear tubes nimu. Now number 2 enhance the production of testosterone.
Oh, okay.
So the baby will be producing more sperms that will be able to mature and release them. Ebetumi aboa mo eti.
When ayema will be on no fisi e wo no onwo
yes, whether one would that and bium and I say on da cry. Sometimes a bit it's like you just get to the gate. Now I sign which if you sperm a quack drew gates in the home bar, if you ne acrosome hona enzymes no ebe dissolve eggshell no and no name to me and you know some of these products no enhance the sperm's ability to me and fertilize it at the amount and usually no what movie in but you say and not just say we a kojo tosa there be you need some of these things to enhance your ability, the sperm's ability to fertilize the eggs.
What boy do be say so na emema no ne ye ka ho asemi ye wo enuane bi nso ombetimi edi e dia support so mo no maduro bi say ya
and the enfane say your friend atadwe right tiger nut eboa increase or sperm no their motility and the semen volume. Polinia pinnata 20 ni sana binum efre no ti omo ton atadwe no usually omo wodua bi egugu atadwe ne ho eno nso utumi wiwi bi na otwe ensu o memene ehon nsuo na eno nso eboa ma sperms no motility omo target no they are able to get to their target because there is an affinity that the sperms have for the egg. And he says omunya setting out after say ya project omo into the vagina and almost setting out so omo kwa they must go towards the egg. And some of these things, the chemicals in them, I mean the active ingredients, so to speak. Active ingredients in it to me to me move it towards the egg.
The doc solution for a man also so. Seba hormonal issues no near there and also so a drubi or hosa.
Yes, a drubi one. They said you were fertility for men, you were fertility for women, and so and fertility for women, what it does most of the time, hormones.
Okay.
And we crown say be our menses and may it's say menses hormones and Emma menses no eba no uyu so a ebetumi ama menses no aye okay but wa on worry ye no emfa we entreat menses one we ya na akoto afanche na problem bi aba aha enti use menses edro na the person wonyi nsen no on use fertility for women no na nsiesie no ne hormones no na emma conception into me emra.
Okay, na obi of fibroid and ovarian cyst and also treatment, options in being
ovarian cysts, usually, some of these things, either they are genetic, they are genetically motivated, or they are hormonal. For fibroid, beginning, menses na into me ma. I started from a point. One thing leads to another, one thing leads to another, then it's growing. Okay. There may be other factors, but when you take the medicine, what it does is that the hormones that are necessary for pregnancy development, those will come in their right quantities. Now, but when you usually say, who you see, we would like you to use it with the aid of a medical herbalist. Okay. What assess where we now onim say this is the condition. Also be for 2 tablets, BD, anopani enyumre, and I say for 1 tablet, anopani enyumre.
Message via ba opese uhu pa say products here o chiri. Ehinu benye bi na ayesan so. All right, it is our product we are doing. Seoba Health Republic Homeopathic Clinic. Your Malam Junction, to free Kaswa Airqua, your Unsabenkum so Eco Bank dan kese na ewo ho no okọ ni nifa so kakra bon se Airtel Tigo ewo ho ti ye ne Airtel Tigo fo na ewo ho no enti oba ubenya product ni bi ewo ho afen so ya supply e de ama pharmacies across all pharmacies in Ghana. Enti okwa ubenya fertility ni bi ewo ho. Ye wie so ye the number bi ebe tudwa ansa na obe set out fa number no tudwa popre kuma.
Aha, enti obe project amaye why omomodi anon project mai. Ti obe project number odi kan fa number no wa frɛ. Na wa kan che ne ba bi awo ebia me wo so menya de a ene ye kɔ this pharmacy, please, are you getting my point? Okay. Aha, ebia ha no a kyerɛ the respective clinical and a pharmacy a ben ho a obetumi enya sa edro yi bi na ye use ne kama. Okay. May ye sure so we use we ya on tap for mu na wonam no. All right. There is no
number me back e wa ha no 0548785292. Yes, and then eda eye afidie no so no. 0548785292 0548785292 and I have 4 bit me after Samsung 054-753-9051 054-753-9051 now 055-726-8828. Good. And one at that screen so no for bit me for numbers me and saying na what me for Health Republic for na what me enya imra yabo ho dawuro enne no ye de supporting infertility problem. Dog, my final words.
Look, abrabomo no issues ewo ho obia woni issues enti say bia waware na when we say the challenger wo on infertility and funny say you are at a dead end there be ena emfa ne say watching so much na one no munra na watoto nro hospitals akese ne ade don't give up bomodia na ma wonsa enka fertility bi wonsa eka bi na wo use a you have our contact, we can be guiding you through entinye say bia wo ya anko na wato edo na wo konom there bi we are one big happy family enti o issue bia with edrona you can call in and we will guide you as to how to use the medicine and get the most out of it e bia o side issues bia eno na air cause infertility no ebia erectile dysfunction and I say premature ejaculation sane ma nyina ewo ho no ma of course one madre na say be man en sorry still na untumi emo adwuma so we can help you to seal all these other loopholes said e be ya awon one kasa ubetumi atutuo e de ato wife eyefunu mu na mo awo ba ama enije abafie Health Republic Homeopathic Clinic ena enemu adi ehie.
Doc, the binya wa also personal line.
All right. And personal line ABA for the discussion or person bisa question be personal line here 055 88 99255 055 88 99255.
Now the better was ye pa Dr. Andrew Sofusu Alfred Ashaiman ton na obeka yensa ewa ha. Yami inshallah yi say o ma yesa encheche yami atuma enche besan ediehia. All right. Okay, better say. Ode share manager be say mo afidi no eda me tendency so no watimi asua de wonya bibi kakra eye nimdie kakra de aka kakra na onim dada no ho. Yame ya adoma also for Dr. Ahmed Koku so mesan ni wadi ehia biom eye na wotwe se na ewo dwumadi so. E besan ehia. Bye.